Sensory neural hearing loss occurs naturally as part of the aging process, and this is known as presbycusis. However, hearing loss can occur in an acute fashion secondary to a number of different causes, including ototoxic drugs, as well as extreme noise. Now, noise-induced hearing loss occurs due to damage of stereociliated cells in the organ of Corti. Loss of the ability to hear high-frequency sounds usually occurs first. Now, what are some other symptoms that you might have in a patient who has sensory neural hearing loss due to taking an ototoxic drug? So, you might also expect tinnitus and vertigo. Now remember that cranial nerve 8 is the one that carries information from the vestibular system, and this is important for balance. Now, one thing to think about when approaching a question about hearing loss is whether it is symmetrical and what the time course is, right? So we want to think about symmetry and time, because that's going to tell you a lot about the etiology. If it is bilateral and progressive, then it is much more likely to be part of the normal aging process. However, if it is unilateral and acute, then you're more likely to be thinking of some sort of pathology, something like tumor, or as we refer to, ototoxic drugs. In fact, tumors within the ear canal can lead to another type of hearing loss, conductive hearing loss. This type of hearing loss is the result of anything that serves as a barrier to sound waves getting into the eardrum. So this can be caused by a number of different things: cerumen, which is basically earwax, otitis externa, and even sometimes media, and tumors. And certain tumors and conditions can also result in a mixed hearing loss that is a result of both sensory neural hearing loss, so a problem in the actual nerve, and then conductive hearing loss.